Good afternoon, everyone. We'll give everybody just a minute here to join the webinar, and we will get started here momentarily. Hi, everyone. Welcome. We'll get started here in just a moment. All right. Hello, everyone. Welcome to the April 2023 PQA Quality Forum Webinar. I'm Amanda Ryan, and I'm the Director of Education here at PQA. Today's topic is innovations in pharmacy to advance quality. Before we get started, I'd like to walk you through our routine housekeeping items here. First, please do submit your questions to us during the presentation portion of the webinar today. You can use the Q&A feature that you see at the bottom of your screen. We are going to have extended time today for discussion, so please do send your questions as soon as you think of those, and we will include as many as we can in the time allotted during the discussion. Also, the webinar recording and the slide deck will be available to PQA members within the week following our webinar today, and you'll be able to find that on the Member Resources Library section of the PQA website. And then the webinar recording will also be posted publicly on PQA's YouTube channel. And then finally, I would like to encourage you to please complete the 1-minute survey that will pop up as soon as the webinar ends today. We do use your feedback to influence future programming. And with that, it is now my pleasure to introduce you to today's speakers. First with us is Crystal Lennartz, who is the Vice President and General Manager for Health Mart Atlas and Atlas Specialty, which is McKesson's Pharmacy Services Administrative Organization. Also with us is Stephen O, who is the Director of Network Performance at Health Mart Atlas, where he serves as the subject matter expert for performance measures and participates in creating customer-facing products to improve network status. Thanks to both of you for joining us today. And with that, I will turn the floor over to Crystal.
Thanks, Amanda. We really appreciate the opportunity to participate in today's discussion. And I'm also really appreciative of PQA's leadership in developing a set of standard pharmacy performance measures to try to evaluate really the quality of pharmacist-provided care. As many stakeholders that are on the call are likely aware, PQA has already created and endorsed 5 pharmacy level measures and are really working to drive implementation of those measures. So today we just wanted to discuss a few of the pharmacy performance related programs that our Health Mart Atlas participating community pharmacies have participated in, just to provide a flavor of what we're seeing in practice. And Steve will also share some of the lessons learned and practical tips. We'd love to make this interactive. So as Amanda said, please put your questions into the Q&A so that we can make sure that we're making it interactive and addressing your questions. I'll start by highlighting just a few of the themes that we're seeing in the pharmacy quality space. In Medicare Part D, a lot of the legacy performance structures for participating retail pharmacy networks have remained relatively unchanged for 2023 compared to 2022, and are focused primarily on adherence, closing gaps in care, and also comprehensive medication reviews. But it's important for pharmacies to be thinking about and preparing for the expected changes in 2024 in Medicare related to negotiated price and DIR, which will likely drive changes in terms of pharmacy cash flow and the elimination or redesign of some of the legacy performance programs and metrics. We're seeing a variety of pharmacy or PSAO level related programs also outside of Medicare, primarily in the Medicaid and the commercial space. Some of what we've participated in are even more narrowly focused, so they may be in a specific region or a specific state or client. Historically, we've seen those typically around chronic disease adherence measures, as well as some around medication synchronization and medication therapy management. I just wanted to reinforce that we don't think adherence measures alone really capture the true impact of pharmacist-provided care, which is why we want to support a shift towards more programs that are really tied to outcomes and total cost of care reduction. And while PQA, as I mentioned, has created that validated pharmacy level measure set, we're not really seeing adoption of a standard measure set across payers, and there continues to be variability in their approaches. And so I do think that this still provides a lot of opportunity to fully leverage and measure the impact that pharmacists can have in outcomes. And we're really at a stage now that we need to prepare for this focus and shift as PQA member organizations. In support of this, Health Mart Atlas has been participating in about a half a dozen different quality-based performance programs that have positive payments tied to outcomes. Some of these that are more forward-looking are the ones that are tied to clinical markers like A1C and blood pressure monitoring and control. And we're also starting to see more interest, at least on the pilot front, around the impact that pharmacists can have in helping to screen and refer patients related to social determinants of health and referral to services. So I'm going to turn it over to Steve now to walk you through a couple examples of the programs tied to adherence and care gaps that he's been helping to support our participating pharmacies in.
Thank you, Crystal. Really appreciate that. One of the responsibilities that I have in my role, and I'm very thankful to be able to do, is really work directly with our pharmacy customers and our internal partners to really drive performance measures. Not only performance measures, but I'm also able to help implement and help drive some of the clinical programs that are focused in on customer and patient outcomes. So wanted to highlight a couple of the programs that we're currently working on this year. One is an adherence program where we are the only independent group that was asked to participate in this particular program. And it's a nationwide program, and it's really focused specifically on adherence and really drive adherence for their network patients. There are 3 interactions or actions that our pharmacy groups can interact in or take action on. And one of the interactions that I wanted to highlight was really it's basically an adherence check-in for specific patients that are really low on their adherence score. And the ability for them to interact with their patients, on a quarterly basis, but also get paid for that interaction is a huge opportunity for our pharmacies. One of the things we also talk to our network partners about, or our plan partner about, is if we have a high level of execution, they're willing to open up some new avenues or some new opportunities for us as well. So we're all hands on deck with this particular program, and so far we're seeing a lot of success with our customer constituents. The other program that we are participating in is really what Crystal kind of alluded to with social determinants of health. It's looking at communities that are underserved, that have pharmacies within those communities, and leveraging that relationship that the pharmacist has with the community and their patients, and trying to bridge that gap through identifications of certain needs, certain healthcare needs that they may have, certain services that they may not be available to them, making sure that we gather the information. And the opportunity is also available for technicians through the community health worker initiative, where they can also participate in that. And what we're hoping to see from this, and it's going to be in pilot this year, is opening up other avenues and other opportunities for us to engage and maybe expand our services to our customers and to patients in the community. So whenever we interact with our customers, one of the things that we always try to assist them with is a systematic process of really execution. And through probably thousands of these interactions that we had with our customers, and this is more specifically for the performance measures that are shown in EQUIP, we really approach it in a phased approach, right? So our first phase would be discover, just making sure that the customers and their team, or the pharmacy and their team, really understands what's happening in the industry and the impact of the pharmacy. Also making sure that they level set within their pharmacy, understanding the potential financial impact, the review of their performance so they understand where they currently are, and then make sure that they understand what improvement means for them. The next phase of that is prepare, making sure that they understand and communicate the changes to their employees that are going to be, quote unquote, their champions, or the ones that are really kind of leading the charge for them. The other thing is also making sure they have access to the right platforms to really execute on the actions and increase the measures that we're talking about. Specifically, if we're looking at the PDC scores, making sure that they have access to Equip, making sure they have access to some of the MTM platforms as well. And then when it comes to really choosing your performance lead, or what we call the champion, we want to identify the right person, right? And it doesn't necessarily always have to be the pharmacist. What we've seen in our interactions with customers is really leveraging the technicians to really drive some of these actions, because they're on the front lines just like the pharmacist. They're there interacting with patients. The actions that are somewhat not specific for just the pharmacist as well. And the return on that investment from a labor perspective is much greater with technicians than pharmacists. And then within the start phase, this is kind of the meat and potatoes of what the actions are. And this is really just leveraging and maximizing on the efforts that our pharmacies take. Identifying the right patients that are going to make the impact is going to be critical. Also, when it comes to even specifically around performance measures, which are the plans that are financially impacting the pharmacies, whether it's from a DIR perspective or even a group of patients that have kind of more market share within that pharmacy. And then finally, identifying what type of programs that they may be participating in or have within their pharmacy to help manage that particular initiative, whether it's an adherence adherence program that they're trying to push. What are the adherence components, such as, med synchronization or auto refill or delivery? What are those things that you currently have and assess to make sure that the program that you're implementing is successful? And then the maximize phase, and this is the ongoing process of making sure that you build that foundation of performance around a specific initiative, and then making sure that you continue to manage and monitor that. And then also, once the foundation is built, what other services or what other opportunities can you add on to that foundation to make sure that your pharmacy is positioned in a better spot and also more successful moving forward. So another kind of best practice that we wanted to highlight here from an implementation perspective is, and some key ones that I wanted to point out is specifically around staff engagement. The champion will be the lead for these programs, but it doesn't necessarily mean everybody that should not be aware of what's going on. Everybody should be aware of what's going on, because it could be a pretty important initiative, specifically around even the performance measures. A perfect example would be, you've got your champion working on adherence with a particular patient, and they're working with them for several months. And then all of a sudden, a cashier or technician who has no idea about the program and no idea about the initiative interacts with that particular patient, and the patient says to them, "You know what? I don't need that prescription. I got plenty at home." All of a sudden, that cashier or technician puts it back to stock, and all of the champion's hard work goes down the drain. How do we avoid that? By making sure that, number one, we communicate the awareness, and then number two, how do we add identifiers for that patient, whether it's in the pharmacy management system, whether it's a label, anything that can alert the staff to say that this is a priority patient, and the staff, and then the level of engagement from the staff becomes higher. Provider engagement, this is an ongoing struggle, making sure that we continue to communicate with our providers in our communities, making sure that they understand the services that you're providing, and then also the outcomes for their patients. We've seen success with a lot of our pharmacies just stepping out of their comfort zone, walking out of their pharmacies and really setting up appointments with their providers, letting them know what they do and how they can partner with them. And then patient engagement. Patient engagement is always something very difficult. We're not necessarily there with our patients every day, making sure they take their medications. So how do we educate them? How do we engage them? We talk a little bit about scripting of benefit versus obligation. An example would be, we just had an interaction with a customer. I had an interaction with a customer here in California, and the customer initially, when they were trying to interact with the customer, asking them if they'd like a CMR or comprehensive medication review, said, "Would you like to spend 30 minutes with me to talk about your medications?" Well, the patient declined that offer because they were in a hurry and they didn't really want to spend the extra time, because probably they felt an obligation for that particular time and they didn't have it. Well, I asked the pharmacist to flip the script a little bit, and the pharmacist for the next patient asked, "I'm not sure if you're aware, but there is, or the insurance company pays for a benefit for you to talk to your pharmacist every year to make sure that there's no issues with your medications. They do reviews and get refills as needed. Would you like to take advantage of that benefit?" So from a patient perspective and their perception of what's going on, it's a little bit different, right? So it's about scripting it the right way, making sure that you guys, those that are in community pharmacy, know your patients better than anybody else. So making sure that you come with the right tools to that conversation, whether it's a carrot or a stick, and that's really critical. And then workflow, making sure that the folks that are actually working on this stuff have the time, have the space to be able to impact these measures or impact the initiative. We've all worked in pharmacies where it's been hectic, and sometimes we'll do a drive-by bite of a sandwich because there's no time. But for something like this, where we feel like it is a priority, time and space is going to be critical for success of any type of program when it comes to these clinical initiatives. Goal setting and communication, making sure that you are constantly communicating to your staff, making sure that they understand the progress or any adjustments that need to be made. And then through that, managing and monitoring it and making sure that you guys are progressing in the right fashion. So when we look at the overarching best practice of any type of program that we look at, it's really making sure that you maximize on your time and maximize on your efforts. Identify the measure that you're going to be impacting. One of the things that our customers tend to do that's a little bit overwhelming is they try to tackle way too much. They'll maybe tackle several initiatives or several measures or several patients. Well, that really is overwhelming for your teams and overwhelming for yourself to be able to do that. Target a specific interaction or specific measure or specific program instead of trying to overload your teams with all of the programs, and make sure that's the focus. The next thing is make sure you have access to the key platforms, not only yourself, but also the team members that are interacting with that particular initiative. Identify the impacted patients or plans, right? So the patients, you don't have to necessarily drive adherence for all of your patients. If it's a focus on diabetes, make sure that you're focusing specifically on the diabetic patients and the ones that are potentially outliers within your equipped platform. And then implement a consistent action and cadence. And what we saw that was very important when it comes to program implementation is pharmacists and pharmacy team members and technicians and cashiers, we're all in that environment creatures of habit. So if you are not consistent with your actions and you're not consistent with your day, sometimes it falls through the cracks. So making sure that you are following that consistent calendar or time frame to make sure it becomes a habit, then all of a sudden, it's clockwork and you don't necessarily have to worry about it. It's just something that they do on a regular basis. Documentation is always important. One of the things that we've experienced with our customers is, we've tried so many different things. Has been a response. So we've asked in return, what are those programs or initiatives or steps that you've taken? Well, they can't remember. So if you were to document what they were doing, they're not possibly doing anything wrong. It may be some tweaks in the steps that they're implementing that we could assist them on, or you can make some tweaks to make sure it's successful. And then again, at the very end, continue to always manage and monitor it. There always are going to be tweaks needed, changes needed, some adjustments needed. And then also communicating the progress to your team is always going to be critical to keep them engaged and make sure that they're kind of following the same path as you. So having said all of this with kind of the initiatives and new programs that are available and having this foundation of understanding of how to implement a program, there's going to be a lot more that's coming in the future, specifically around even the two that I presented earlier. My recommendation for the folks on the call is make sure that you do definitely have a foundational program or process in place, and then also make sure that you take advantage of any of the opportunities that are available. Our barometer of success in pharmacy when I was first out of school was always how many prescriptions we filled. And that was literally how we measured success. Well, the world we live in today is definitely not like that. So making sure that you take advantage of any opportunity that will help increase the business of the pharmacy, but also make sure that you're taking care of your patients the right way, I would highly recommend you get involved. Some of the pushbacks that we say is it's not a lot of time. I don't have a lot of staff. Folks on this call, as especially pharmacists, we're very nimble and flexible. So I would say use those traits to make sure that some of these new programs can be implemented within your pharmacy. So having said that, I will turn it back over to Amanda for Q&A.
All right, thanks very much, Steve. Thank you, Crystal, for sharing the work that you both are doing. I want to remind the audience that you can submit questions to us using the Q&A at the bottom of the screen. As I said, we will answer as many of those as we have time during the conversation today. For now, we will start out with a question for Crystal. So Crystal, in your part of the presentation, you mentioned that there's some expected Medicare Part D program updates that are coming. Which of those do you feel like are most important to prepare for, and how is Health Mart Atlas doing that?
Yeah, thanks, Amanda. So each year, the Center for Medicare and Medicaid Services has a final rule that can implement changes. I think the one most impactful that we've been watching and planning for were changes come 1/1/24 to the definition of negotiated price in Medicare. This is really going to require plan sponsors to reflect all of the pharmacy price concessions at the point of sale when you're running the claim in the pharmacy. And this will be a win for patients in terms of their ability to pay the lowest cost sharing. And then it'll also provide additional transparency to pharmacies in terms of the reimbursement. However, it is going to come with some cash flow challenges. So it's anticipated for those programs that historically had DIR, that DIR liability or some portion of it will be built into that point of sale reimbursement. And so essentially, especially in the first 5 months of 2024, pharmacies are going to be experiencing lower point of sale reimbursement while they're still needing to pay some of those 2023 DIR liabilities. So from a Health Mart Atlas perspective, we're working to educate our participating pharmacies on the changes and what to expect. We do have DIR reporting down to the claim level detail that's available for our pharmacies, as well as a DIR assist tool to allow them to calculate what they need to expect for liability in 2024, and optionally the ability for them to set aside funds to prepare for that. So regardless of whether you're with a PSAO or a chain or you contract directly, we're all going to be impacted by these changes. So definitely recommend that pharmacies understand what this means for them. The rule change, however, doesn't impact a plan sponsor's ability to have contractual relationships that include pharmacy payment adjustments. So I do view this as a positive because it still allows for the ability for payers to consider pharmacy performance programs that are upside and have quality metrics like PQA's measure set aligned to measure pharmacies. So we're really still in active discussions with multiple payer partners for 2024 to understand if they're still going to offer pharmacies some of these opportunities and what changes to those programs may look like, so that we can help our pharmacies navigate the changes. I do think it's going to be more than a one-year process. So we may see some changes come 2024. Some payer partners may need more time. They may not have had time to update their bid packets in time. So some of those changes we could see even trickle into 2025, for example.
Yeah, so not unusual to see gradual changes over time, but head in the right direction. So thank you, Crystal. We have had a question come in about whether you all have tried any sort of deprescribing initiative to address polypharmacy. So curious if you've either tried that, thought about that, or if you've considered that for any of your pharmacies.
I mean, polypharmacy has always been a consistent issue across the board, specifically around adherence, right? It's kind of the elephant in the room for some of the folks because they do price shopping. They work closer to a pharmacy. I think what we've always told our pharmacists or our customers is always provide the benefits and the actions of really coming to their pharmacy, and also surround that patient with a service that would kind of bridge that gap when it comes to convenience. So what our pharmacies do is they do a delivery service, majority of them. So what we say is, why not use the delivery service that we currently have? We can have all of your medications in one location, making sure that we understand the full scope of your care, and any other convenience that you have, please let us know. We can address it. And sometimes our customer or our patients really don't know about these services, so communicating those services is critical and promoting them. And that's what we've pushed with our network and our customers.
And maybe Amanda, I'll add on from the deprescribing portion of that person's question. So as a PSAO, we are in a unique position to help our pharmacies in terms of the payer contracts and understanding and signing those on their behalf, but we don't actually operate the pharmacies. So we do a lot of influence without authority. Some of our pharmacies are located in health systems, or they might be adjacent to a provider clinic. And so when they have that established relationship with the providers, it can be a little bit easier for them to work on things like deprescribing because they have that built-in relationship and rapport. But I would say what we've seen has been more localized and not necessarily a program that we've rolled out on behalf of the participating pharmacies.
So like a lot of initiatives, partnerships and the proximity of those partners are really important. So, and thank you for drawing the distinction about the influence versus, being able to directly implement a particular program. So thank you, Crystal. Thank you, Steve, for those responses. We've got another question. Do keep those coming in. We really like seeing what you would like to hear about. So this question is about pharmacy technicians. So Steve, this is probably a question for you, but Crystal, of course, feel free to jump in here. So how do you get technicians on board with seeing the value of quality measures and participating in initiatives like this?
So it's funny that you mentioned that because, a lot of our pharmacists and owners, they gravitate towards kind of the lead tech that's really doing everything as the person that they're going to engage in these types of initiatives. Well, that person may have way too much on their plate. So what we try to do is have them identify some folks that really want to do a little bit more within the pharmacy and may want to participate a little bit more. And then from an identification standpoint, making sure and for them to be successful, making sure that they understand the why and the what and the impact to the business. And a lot of the folks that we work with, specifically in the independent segment, is they're fully vested. Their teams are very vested in the pharmacy because everyone plays a pretty large role. So when you talk about the current climate and the impact and potentially the disruption that's going to happen, there's folks that step up. So the ones that really want to step up and really want to participate are the ones that we really want to, number one, inform, provide them with all the support they need, and then also make sure that they're held accountable for their actions.
Good. Thank you, Steve. Crystal, do you have anything you want to add there?
I feel like he covered it well. I would say, just like as pharmacists, we want to be able to practice at the top of our license, our ability to engage our tech to be able to also do that, I think kind of unlocks the potential for us to do it. I know we mentioned just briefly about SDOH, but one of the ways that we're seeing some of our pharmacies start to do that is by actually getting their technicians trained as community health workers. We've provided some scholarships to pharmacies for them to be able to do that. A lot of times when you go in the pharmacy, the technician's kind of the first line of defense, or they may even pull double duty as a delivery driver. And so their ability to kind of reach in and do some of that assessment and screening and referring to services can be huge. And a lot of times that creates a different, we've heard from technicians in some of our participating pharmacies, it creates a different level of engagement for the technicians. They really feel a part of the care team and that they can make a difference. And sometimes when they feel empowered like that, it's easier to get them on board with some of the other programs as well.
Absolutely. So Crystal, coincidentally, while you were just talking about that, we did have a question come in related to pharmacies getting involved in social determinants of health and if you had any specific interventions to share. So that was one that you just shared related to community health workers and the technicians. Do you have anything else you'd like to share on social determinants of health?
Yeah, I would say we're still fairly early in this work, and a lot of this is in the pilot phase. So unfortunately for confidentiality, I can't say who the payer partners are, but I would say it's kind of test and learn at this point. So one area that we're working in is screening and referral. And I know there's different screening tools. One of those is called Prepare. So the protocol for responding to and assessing patient assets, risks, and experiences. We're also finding sometimes it can be difficult. They may know of a few community resources to connect the patient to, but unlocking some additional SDOH resources where it's easier for them to navigate and know where to refer for transportation or to the appropriate food bank or things like that. So actually in May, we're going to be making a white labeled SDOH resource website available to our Health Mart pharmacies and their communities. And we're going to be supporting the pharmacies on how they can make referrals through the system. So that's going to be our first kind of widespread initiative. And that's separate and distinct from anything that we're piloting with payers in terms of screening and referral.
All right, thank you so much, Crystal. This next question is a little bit longer, so let me summarize it here. So the person asking the question says that they appreciate, Crystal, that you are making points regarding the importance of plans needing to focus on total cost of care versus adherence. And plans seem to be primarily focused on HEDIS, adherence measures, versus total cost of care. And that drives additional revenue for plans. And, we need to also think about improving outcomes overall. So question here after all that is, how does Health Mart Atlas plan to move forward with a value-based care focus with just an adherence focus?
Yeah, that's a great question. I do think it's around demonstrating and documenting our ability to reduce total cost of care and some of those outcomes, and then using that with the payer partners. We're in somewhat of a hands tied situation, is that typically we cannot go directly to the plan sponsor. We would need to go with the pharmacy benefit manager, for example. And so oftentimes it takes getting that plan sponsor on board, because they're going to be the ones that have the view into the full total cost of care. In a few cases, if we're able to provide information that otherwise the plan would not have access to, or they've tried through some of their other mechanisms like a call center, et cetera. Oftentimes we can get some of these opportunities, but they tend to be towards the end of the calendar year. And so it can be harder and harder to operationalize by the time it gets to us. So we definitely want to be a part of the solution, but we won't be able to do it alone. There's really a lot of work that's done by our participating pharmacies, and we need kind of willing PBM or plan sponsors to be able to go alongside us. I know there's some interesting work that PQA has been doing to kind of matchmake and bring together payers and pharmacy partners. And I hope that that work can continue to accelerate, because I don't think we can have enough of it at this point.
Yeah, absolutely. Back to the partnerships theme here, definitely critical across the board. So Steve, I've got a question for you, a little bit more related to the operational side of things. So you mentioned earlier the need to use multiple data platforms to not only target your efforts, but also monitor the progress that you're making. So can you share any lessons learned about how to do this effectively when you're juggling those multiple platforms?
Yeah, so we get a lot of different data sources from a lot of different vendors, but ultimately what we want to do is really pinpoint what our ultimate goal is from a measure perspective or an outcome perspective. And specifically around, I'll give an example around, say, the diabetic PDC that we've been focusing on the last couple of years, is we'll get a lot of information around opportunities around diabetes, but with the way we approached it is, and especially how we've implemented it with our customers is, if we have an overwhelming amount of data and information and we were to transfer that or provide that to our customers, they would become overwhelmed and then they would disengage. So what we did was take all that information and try to create a actionable kind of bite-sized piece way of interacting with that particular initiative. So for example, we would say, let's focus on a group of patients. Based on the data that we have, we'll narrow it down to a specific group of patients that make the largest impact. So say an adherence outlier, we would say, let's just focus on the folks that are 60 to 70% in your outlier and start working on those patients, because based on the data from all the other things they have, MTMs that they need to work. But if we start leveraging kind of that targeted approach with a specific group of patients, the outcome of that is pretty tremendous. So what we do is take all that data, try to digest it, and then make sure that the data that the patient or the customer in the pharmacy sees is very targeted and manageable, so that they don't become overwhelmed by all that information.
All right, very good. Thank you, Steve. Sticking now with a theme here related to how to operationalize some of these performance programs. Crystal, earlier you alluded to the fact that a lot of the programs Health Mart Atlas is working on right now are smaller in scale, and that is definitely something that we see. It's very typical, especially when you're starting with something new and looking to improve quality. So what are next steps that you're looking at to increase the scale of some of your programs, and what challenges do you face in doing that?
Yeah, I would say the widest scale programs we've seen have been in the Medicare Part D space typically. And so with all those changes coming for 2024, we're having the conversations I mentioned before on what those programs might look like, because I do think there is still potential there. But oftentimes one of the reasons why they're limited in scope or size is they may be specific to a certain client or even a certain state for a payer where they've had pain points and want us to focus. I do think those will still continue. And I think as we can prove the value, we've seen some of those expand across multiple states or multiple clients. But unfortunately, I don't think on a broad scale, especially in the Medicaid and commercial space, we'll see huge programs. I do think they'll tend to scale like they have been, adding on states or adding on clients. Some of the barriers that we face, Steve mentioned different platforms that we provide or that payers may pick. And so we do equip our pharmacies with equip, no pun intended, but sometimes payers will have us go to their own payer portal to access information or go to another third-party vendor. And so sometimes when you have disparate types of measures and disparate platforms that are being leveraged, that can be a barrier. So I think the more we can see adoption of whether it's, standard measure sets, whether they're used on different platforms or not, and more continuity in those, I think that will help us in terms of scalability and implementation to the pharmacies. And I don't know, Steve, if you want to add anything on, but sometimes it can be kind of complicated for the pharmacies to know where to focus when it's scattered like that.
Yeah, absolutely. It's difficult. One conversation, it cannot be had by all the pharmacies across the country, just because the opportunities are completely different. So us as a support model, we try to identify those opportunities and bring it to them. So yes, it's hard to scale. Number one, scale something that's not scalable, and then number two, make sure that we identify the right opportunities to bring to our customers that are specifically in those markets.
So absolutely a certain level of customization and flexibility needed there, which makes perfect sense. Yeah, okay. So continuing with one more question related to kind of how to operationalize all of these things. Steve, you encourage the use of what's called a performance day to promote consistent action in your pharmacies. Can you tell us more about what that is and how it works?
Yeah, so even though we've lived in this world for probably 4 or 5 years, as far as the performance metrics being a pretty large part of the financial impact, operational and clinical impact of the pharmacy, we've tried to be as non-invasive as possible with our approach and how we recommend implementation, how we recommend them tackle this particular initiative. So we started small in the sense where we said, let's pick a specific day that you have that either you have the most staff or you have the most or the least amount of work, and you identify that champion and make sure that that champion is positioned where they have space, the time to be able to impact this, and make that as consistent as possible. Because as I mentioned before in my conversations, folks that work in the pharmacy are creatures of habit. So sometimes you definitely have to be consistent in what you do and how you do it in order for it to just become second nature. So we've tested that. It's become kind of a thing where we call it the performance day, and we've implemented it across the country. And there's customers that we'll talk to and say, hey, how's your performance day? Wednesdays are always great. Wednesdays are the day that I do it. So building that consistency, and then also if there's more opportunities, they know how to kind of implement new initiatives because they'll leverage that performance day as a time that they're going to work on those specific performance initiatives. So it becomes kind of a routine thing for them.
Yeah, capitalize on those habits for sure, and that routine. All right, thank you, Steve. I want to remind the audience one more time, if you do have any questions for us, we've got a little bit of time left here, so please go ahead and send those in. Otherwise, we've got a few more to get to as we find out a little bit more about how to implement performance programs. So Crystal, the last couple of questions for Steve have been kind of related to operations and that sort of thing. So maybe if we can take that idea and zoom out just a little bit and talk about potential recommendations you have for other pharmacies who are looking to implement some sort of performance programs like this.
Yeah, I think Steve gave a nice framework around making sure that the pharmacies understand how and where they're being measured. So what payers have programs, and putting together those steps in terms of an action plan on how to get after it and being really intentional about it. I think especially when programs are pilots or just starting out, it's really important that we hit the ground running and have the ability to prove ourselves. And I would just say, because I know that it's a multi-stakeholder organization, so there's non-pharmacies on the line. If there's technology companies or payer partners, we need your help too. And I think the more we can adopt the standard measure set and license the PQA specs and use them how you guys intend, it'll make it easier for us on the pharmacy end to be able to execute those programs and to be able to really move to value-based reimbursement, which we want to do as a profession.
Right.
Yeah, and I would say just that foundation is always critical. Making sure that you have that foundation, because then you can go back to that same process every single time there's a new opportunity, and it's not recreating the wheel, or you're not building a house of cards, right? So making sure that that particular program or initiative that you're going to implement follows the same process and the same rules as some of the other stuff. Making sure that you understand what's going on, making sure you have the right access to the right people or right platforms, and identify the right person that's going to lead the charge. Continue to target your time or target the right folks, whether it's patients or plans, to make sure that you're maximizing on your time, and then manage and monitor it and look for new programs or opportunities once that foundation is built.
All right, very good. Thank you, Steve and Crystal. Steve, a kind of switching themes a little bit here and talking some more about those partnerships and how you can, partner with both patients and providers and really engage effectively with both of those types of stakeholders. So you talked about the situation where your staff has done, a fair amount of legwork to identify a patient who needs support with adherence, has, got that medication ready to be filled. And then when the patient comes to pick it up for whatever reason, they decline to take that medication with them. So how does your pharmacy staff, you've kind of talked about how they work together, but when they interact with that patient, like what does that interaction look like? And what have you found to be effective in that area?
So to be honest, I mean, the huge benefit that we have with our customer group is independents tend to have a really strong relationship with their patients. And that relationship has been established through a long amount of time, through many interactions. So I think the key to that is just identification, right? So identifying that gap. So that person is a potential adherence outlier. So making sure that everybody is aware of that, and then have a script or a plan in place to make sure that you reinforce that message of them taking their medication and really investing in their own adherence. Some of the scripting that we would highly recommend is, I'm not sure if you're aware, but the insurance companies are monitoring you as well as they're monitoring us. So making sure that we could become partners and really driving this initiative or this program for you, and then you don't get harassed by any phone calls, right? So those are the things that you can actually leverage based on the experience of you with the patient, and then making sure that you do a lot of follow-ups, so specifically with those patients that maybe are a little less not only engaged but less versed on the importance, making sure that you reinforce it and continue to push it with them. Eventually it'll stick. So it's commitment of time, and it's investment of time, it's commitment of reinforcing of the message. And we've seen success with patients when they have that approach.
Crystal, did you have anything you wanted to add there?
No, I think Steve's more the expert working with our pharmacies day in and out. So he did a good job covering that one.
Very good. So Steve, then continuing with that theme, we talked about just now engaging with patients. You also alluded to the need, of course, to engage with providers. So what kind of education or collaboration have you done in that area, and what works well there?
So most recently what we've done is, based upon the relationships that the pharmacy has with the patient, we've leveraged that to communicate to the providers. So we've said, oh, by the way, Mrs. Smith is one of our patients, and we have her in this particular program that's going to help drive adherence. She's been our patient for X amount of years. These are the things that we're doing to help support her. And we understand that there's certain measures and certain things that they're measuring you on around adherence. So I wanted to inform you and work with you and collaborate with you to make sure that we drive outcomes specifically around this particular patient. So their access point is that patient. Their pitch or their level of engagement are the things that they're doing to not only help the patient but potentially help the provider. And then the ability or the request to consistently be in communication with them to make sure that both them and the patient are benefiting from that particular collaboration has worked with our patients, specifically within their communities, or their pharmacies and their patients within their communities and the providers.
All right, very good. Just a couple questions left for you both as we wrap up here today. Stephen, got one more for you, and that is just, can you share a success story with us? You all have done a lot of work in this area, but you have a specific example of a success story that you can share with our audience.
Yeah, so I have I'm really excited about something recently that we got some numbers around. So I talked a little bit about that adherence program that we were the only independent that was able to participate in. And we don't have call centers. And to Crystal's point earlier, we work on influence and not necessarily dictatorship. So we identified through data, there were several customers that had a large opportunity for those adherence check-ins with our customers. And brand new to the program, we had to create a communication strategy. We had to provide best practices. We had to provide resources. And with the help of everybody within Health Mart Atlas, everybody within McKesson, we were able to kind of create this program. And one of our top pharmacies that had the most opportunities was really not engaging in it whatsoever, but the ability for them to engage was tremendous. So we worked with our internal field partners, our advisors, to really help kind of have them understand the importance, walk them through the process, and have them kind of engage in it. And I will say, as we stand today, it's been only about a month since the program launched. They've executed on 1,500 cases, which in turn could result in over 6 figures in dollars earned through that particular opportunity.
That's great. Thanks for sharing that with us. And Crystal, to kind of bring us full circle here, towards the beginning of your presentation today, you mentioned that PQA is developing a standard set of pharmacy performance measures. So let's, get our crystal ball out here a little bit. So what do you see as the greatest opportunity for community pharmacies to fully engage and leverage pharmacist impact and show that impact through measurement as we proceed here into the future?
Yeah, understandably so. I think where PQA started was respecifying existing plan level measures, but for pharmacy around adherence. And so while that was a great first step, I think the ones that excite me the most are metrics where we can show improvement in things like A1C, blood pressure, and even beyond other types of outcomes. If I think about a success story, even kind of building on Steve's last question, there was a program that we participated in, and although it was small in scale, we were able to drive about a 20% improvement in the patients in that program meeting their A1C goal. So it was about getting the patients on the right medications and right dose. To one of the comments that came through in the Q&A, that really drove meaningful results for the patient that were measurable. And so those are the type of programs and measure sets that I think we need to strive to make sure get adopted more broadly across all of our across the industry.
All right, very good. Thank you so much, Crystal. Steve, any last words to add for today?
The only other thing is there's going to be a lot of opportunity that's going to come down. It's, our traditional thought process that we don't have enough time or we don't have enough staff. We have to kind of overcome that, because this is a great opportunity for us to kind of show what we're worth and practice at the top of our profession. And I think any advantage that you have to be able to showcase what we can do, I think it's going to impact all of us. So please engage.
All right, very good. On that note, I would like to thank both Crystal and Steve for joining us today. We appreciate you sharing the work that you're doing and the insights that you have to share. Look forward to seeing all of this grow and proceed in the future. So we will close out today with a few announcements. Let me drop a couple of links in chat for you. So we invite you to join us May 10th through 12th for the 2023 PQA annual meeting that will be held in Nashville, Tennessee. If you have not registered or you do not have your hotel room yet, there is still time. This three-day meeting is going to feature speakers and educational sessions that address top issues and emerging trends in medication use quality, also in measure development and implementation, as well as care transformation. I did drop a link for you in the chat so you can access the registration and the hotel information. And then in addition to that, we invite you to join us for a pre-conference workshop that will be held on May the 10th. That is Medication Use Quality, a PQA live CE event. It is accredited for 4 hours of pharmacist CE, and it will allow participants to engage with faculty in question and answer sessions, as well as dynamic group discussions and activities. And I have also dropped the link in the chat for you to register for that pre-conference event. PQA also invites our members to attend our second quarter stakeholder advisory meeting, which will be held on Wednesday, June the 7th from 1 to 2 o'clock Eastern time. This is a members only staff hosted meeting where we will share measure development and maintenance updates, as well as upcoming engagement opportunities. Registration information will be available in the member resources library on the PQA website, and you can also watch your email for upcoming information. And then finally, we hope to see you again in July. Our next Quality Forum webinar will be on Thursday, July the 20th. We'll have more information available for you on both the topic and registration. So as we get closer to the webinar, please also watch your email for updates on this upcoming Quality Forum. And with that, I would like to thank you so much for joining today and have a great rest of your day.